Thank you, everybody. It's good to be back with multi-languages. I don't know, I see Lola now on the screen.
Yeah.
Okay. It's good to be back to do things with multi-languages. I have done events with them in the past. I worked with multi-languages. I was an interpreter and translator for many years before I decided to go and pursue my passion, which was helping people restore their health and optimal function. And I am here today to talk about stress, because stress is very important in how it can affect our health and our lives. And there are some simple things that we can do to lower it. And I know by the end of my presentation that you will see that what I say is not rocket science. There's not much new to what I have to say, but I would like to help you pay attention to what actually happens when we're dealing with stress. This was there. So a simple explanation to describe stress is a description of the Cleveland Clinic, which says that it's the body's reaction to any change that requires an adjustment or an adaptation. So it's first our brain that perceives that stress, and it's how our brain perceives it and we interpret it that we have that reaction. And we have three kinds of stresses. So we have good stress, tolerable stress, and toxic or negative stress. And then we'll talk about acute and chronic. So the good stress is when we have a positive outcome from, let's say, rising to a challenge or taking risks or anything that we do, and then we're being rewarded. So this is a good growth opportunity. We have growth experiences with positive outcomes. And that adaptation helps us promote resilience. So the more we're rewarded for things that we take risks for and it works out well, our brains adapt and they know they can handle that. So the next time the stress is lower. And this is also stress that lasts for a very short time. Then we have tolerable stress. That's when bad things happen, but we are able to cope because we have friends, we have family, and this causes some distress, which is an uncomfortable feeling due to the nature of the stressor. And it's also our inability to control or influence the stressor. So this will cause some distress, but we're still able to deal with that. And then we have the toxic or negative stress, when bad things happen and we're not able to cope so well, which affects our behavior and our physiology. And we will talk about this later on. So this is distress to a higher degree and of longer duration. I'm sure you've all heard about acute and chronic stress. So acute stress usually happens in very specific situations, and the hormones released, it's cortisol and epinephrine, I'm sure you heard of adrenaline, help your mind and body deal with the situation right away. For example, quickly moving away from a car that's coming towards you, or from a falling tree, or from something that your nervous system perceives as stressful immediately before you even notice it consciously. So in acute stress situations, the sympathetic response, which is a branch of the autonomic nervous system, causes the release of these hormones, cortisol and epinephrine, which cause an increase in heart rate, an increase in blood pressure, which allows more blood flow to your muscles and more oxygen to the brain. So evolutionary, we needed this because this is the typical fight and flight, right? So we needed to run away from the tiger. So we need more oxygen, we need more blood. This is why we have these reactions. Glucose is then released in the blood to allow us also for a boost in energy, and your digestive system slows down and the immune system is shut down completely. Because when you need to run away from something, your body doesn't have time to digest food or to take care of an infection that's going on. Chronic stress, on the other hand, is a low-grade, long-term exposure to a stressor, which can be stressful events or situations that result in repeatedly triggering the sympathetic response that we talked about. And it's this release of repeated cortisol and epinephrine or adrenaline that trigger a cascade of other hormones in your body and affect all your systems. So whether you feel it or not, it affects your adrenal system. These are some little glands that sit on top of your kidneys. I'm sure you've heard of the adrenal dysfunction that deal with stress, the thyroid, the gonads, and so on. So you'll talk just about a cascade that can affect your whole body, and we will again talk about this a little bit later. So what happens in our body, which is what we will be talking about now, as I said before, there are some behavioral and physiological changes which are a response to trigger an adaptation. So in terms of behavior, we have changes in appetite. We can eat too much, or some people can't eat when they're stressed. We can be irritable, we can have anger bouts, we can have mood changes. And to deal with these, a lot of people resort to using drugs, alcohol, or tobacco just to calm themselves down. So these are all behavior changes. Physiological changes, as we talked before, is the increased heart rate, the blood pressure, the blood sugar. If we don't deal with this stress, that blood pressure can remain high, that blood sugar can remain high, and then it turns into other more complicated health problems. Chronic stress leads to pathophysiology. What is pathophysiology? It's increased. Pathophysiology means it's a disordered physiological process, usually associated with a disease. So then we have structural changes in the brain with long-term effects on the nervous system. And there are studies that show that long-term stress can shrink the brain. There are even some ideas that find a link between stress, long-term stress, and Alzheimer's disease, just because the brain shrinks. There are changes in the prefrontal cortex and the amygdala. So the prefrontal cortex is the part of the brain that is responsible for decision-making. So, of course, our memory is impaired, our decision-making is impaired. We're dealing with anxiety, fear, cognitive function, behavioral control. So as you can see, long-term effects of stress can lead to significant changes. How does this affect us? We start suffering from anxiety. We start suffering from depression. We can't sleep. We have headaches. We can have an upset stomach. These are all signs of long-standing stress. Panic attacks, they mimic a heart attack, and they're from stress. Dysbiosis. So dysbiosis is when your digestion is not functioning well, when your microbiome is not properly balanced. And there is a gut-brain axis. Maybe some of you have heard of this. So what happens in our gut is affecting our brain. If there's inflammation in our gut, it's affecting how we think and how we perceive stress, and it can actually trigger depression. So this is something that can be a whole different topic to discuss. There's, of course, weight gain, because a lot of people stress eat. We don't always eat the right things. It can cause cardiovascular disease, just because the maintained inflammation in our bodies creates those atheroplaques. And type 2 diabetes, again, with insulin resistance from the long-standing blood sugar that's running through your veins. There's also an increased risk for cancer. Some other warning signs of stress are just dizziness, aches and pains, tension in your muscles, in your neck, grinding teeth at night, indigestion, acid reflux. So these are all warning signs that you might be dealing with stress, long-term stress. And the good thing about all this is that we can do something about it. And like I said, what we can do is not rocket science. And I know to a lot of people, these things sound too simple to be true or to be, you know, even making significant changes, but they are making profound changes and they are helping you deal with stress so much better. So the first one I would like to talk about is abdominal breathing. Everyone is talking about breathing. Everyone is taking some kind of courses. There are so many people talking about how to do breathing exercises. And we consider it too simple because it really is simple and it helps so much. So when we do deep abdominal breathing and the exhalation is longer than the inhalation, that actually triggers a parasympathetic response, which is the opposite of the sympathetic response. So it helps our nervous system to calm down. So if you want like an instant calming effect, you can just take a deep breath in, hold it in for a bit, and we'll talk about the details later on, and then exhale. And as long as your exhalation is twice as long as the inhalation, it will help you trigger a parasympathetic response and calm down. We take tens of hundreds of breaths per day, and we don't pay attention to these things. And that's why it's important at least a few times a day to take a break from what we're doing and take some deep breaths. Start with those early in the morning, take another break at lunch, and do 10, 15 deep rests. The next one is drinking water. Again, very simple recommendation. Our bodies are between 65 and 75% water. When we feel thirsty, we are already dehydrated. I'm sure you've heard all of these before. But in order for our bodies to function well, our bodies will always keep our brain hydrated first. And then it will take, if we don't drink enough water, it will take water from our organs, from our muscles, to keep our brain functioning well. So if we don't drink sufficient water, we will be dehydrated, we'll feel dizzy, we will feel stress will be exacerbated. So what does this have to do with stress? Is because you perceive, it's how your brain perceives it and how you feel. And sometimes just taking some deep breaths and drinking some water can help you feel so much better. You're not tired anymore. A lot of times when we're tired, we're dehydrated. And we'll talk about the quantity of water. I know the general recommendation is to drink 8 glasses of water, but each person is different and we have different heights and different weights. And water intake actually has to be adjusted. So if you're exercising, you need more water. If you're spending a lot of time outdoors in the sun and it's very hot outside, you need more water than the recommended 8 glasses or whatever it is for your body. Plain water is the best, filtered water, just to allow your body to absorb it. Then it's meditation, yoga, or gratitude. I put all these 3 together because sometimes it's easy to just do all of them together. Again, we don't take enough time to sit in the morning when we wake up to just meditate for 10 minutes. But we can do some yoga, just some stretches and some movements in the morning to get our bodies going while we think about 3 things that we are grateful for. Gratitude has a lot of research, the same as meditation and yoga. They have a lot of research that they help change our brains. So our brains are very plastic, meaning that they can change. And if we find every day 3 things that we are grateful for, we're actually looking for the good things that happen in our life. So our brains will shift from all the negative to the positive. And as time goes by, if you do this for 30 days, you will start seeing more good things in your life and around you. And even with this whole pandemic, I'm sure if you were to take a moment right now and write down some good things that have happened in the last 3 months, with all the anxiety and all the stresses and all the bad things that have been going on, there are still good things that happened in your life. And if you start being grateful and appreciating those good things, that will help lower your anxiety and lower your stress. For example, and I'm giving you an example from my life. I have been spending more time with my family, with my youngest daughter, who has been at home because she's not working now. We have been able to take walks, to talk, things that we hadn't been doing before just because there was not enough time. So please take a moment today and write some good things that came out of this entire pandemic and the entire negativity that surrounds it, and try to see, make a list, write 10 things. What has changed for the better? What is good right now? Meditation, you can do a walking meditation. You can do, just sitting calmly and looking at flowers in your backyard, or walking through a park. It doesn't have to be something where you sit like that young woman on her bed. Ideally, I would love to sit on that beach and do a meditation, but it doesn't have to be something that's so restricted and so, okay, if I'm not a monk right now and I don't hold my fingers like this and I don't sit cross-legged, it doesn't count as meditation. As long as you're comfortable, do your breathing, and you're just sitting in quiet, trying to calm your brain. It just calms your entire nervous system, and it allows your hormones to find balanced, how they work and how they influence each other, and you will just feel better right away. The next 2 things, movement, walks. We talked about this. The importance, and why I wrote it in capital letters, to do it outdoors, is because when we spend time outdoors, the fresh air, nature, affects our systems and our health. So if we spend 20 minutes in sunlight during the day, of course not in the middle of summer in the middle of the day, because then it's too hot, but 20 minutes of sunlight exposure has been proven to increase serotonin levels, and serotonin is the happy hormone. Then sunshine also makes vitamin D, which is an important hormone for bone strength and teeth strength, and it's also protecting, it's a good immune boost. So it's very important to move outdoors for like 30 to 45 minutes. And exercise has been shown, and I'm sure Dr. Devine will talk about this, but exercise is one of the first interventions that's used for depression, when depression is not very severe. The first thing that doctors ask patients to do is to start moving and to start walking. We spend way too much time indoors. We spend time in front of our computers. We spend time driving. We spend time in front of our TVs. We don't spend enough time outside in nature. And I promise you, if you start doing that every day, you will feel a change. You will feel better. You will feel calmer. It will improve your sleep. You will definitely sleep better. You will notice you're calmer with people around you. You have more oxygen. There are only benefits from living and walking outdoors and exercising. Of course, people who want to exercise, running, cycling. I've been so happy to see so many people and children on their bicycles in the last 3 months outdoors. Like it's fantastic. And now one of the most important things that you can do is add color to your diet. You've probably heard this before. I just put some pictures here to show you how amazing nature is. And each of these like fruits and vegetables have enormous health benefits for you. They are anti-inflammatory. They are protecting your cells. They are protecting your liver. They are helping your liver detoxing without you doing anything else. You don't have to do it, it's just eating fruits and vegetables and adding color. And this goes back to what we talked before about dysbiosis. Our diets, especially in North America, are way too much focused on pastries, and we're drinking too much coffee, and we're not eating enough water-containing fruits and vegetables. And this goes also back to the fact that our bodies are 65 to 75% water. And if we eat bread and pasta and pizza, those are more dehydrating because they do not contain water. So then we have to drink extra water. Coffee is dehydrating. So I'm not saying you shouldn't drink coffee, you shouldn't eat pizza. I'm just saying whatever you do, add color to your diet. It will make things better in the long run, and your digestive system will improve. You're adding fiber. You will have a better and easier digestion, and that can affect your brain, and it can affect anxiety. It can affect depression because of that gut-brain axis. So there are 6 colors that we can add into our diet. It's the red, orange, yellow, green, purple, and then the white, brown, and tan. And the more of these you have every day, they will eventually, you will develop a taste for them, and they will crowd out the bad things. So our action plan for today is very simple. So I would like you to do 10 to 15 abdominal breaths 3 times a day. You will inhale to the count of 4, hold your breath to the count of 4, and then exhale to the count of 8. And you want to do this slowly, because that's how it will help calm your nervous system. Drink water. So a rule of thumb for drinking water is half your body weight in ounces. So if a person weighs 180 pounds, half of that is 90, and that would be in ounces. So that's 90 ounces of water. And this is just baseline without taking into consideration a very hot day or exercise or excessive sweating. So if you do all those, then you need to add to that. Ideally, also you drink a glass of water early in the morning, first thing when you wake up. Meditate, do yoga or gratitude, or all 3 together for 10 to 15 minutes every day. Exercise outdoors or move for 30 to 45 minutes. And aim to eat 1 item of each color every day. So out of the 6 colors, you would add 1 of each to your diet, and make this into a fun challenge. Add it to a smoothie, make it into a salad, or just cook with it. It doesn't have to be raw. You can really have fun with it. So I hope this action plan makes it easy for you to follow. And I promise you, if you give it a try for 1 month, you will notice changes in how you are perceiving stress and how you're able to handle it. Thank you very much.